Welcome to this new episode of the Virulent Vortex, a podcast in which we discuss infectious diseases across scales, from molecules and pathogens to populations, pandemics, and everything in between. My name is Jaap de Rode. I'm a biology professor here at Emory University and today's host of this show. And with me today is Matthew Collins, Associate Professor of Medicine here at Emory University. Matthew, welcome to the show.
Thanks for having me. Glad to be here.
So, Matthew, I introduced you as an associate professor, but clearly you're also a doctor. So doing clinical service, can you tell us a little bit about that before we dive into your research?
Of course, yes. I am in uniform today because I'm currently working in the hospital. I'm an infectious diseases physician, and I see mostly patients that are in the hospital with some infection problems. Sometimes we don't know what it is and try to figure it out. Sometimes we do know and we try to help manage it.
Yeah.
And I also see patients in the travel clinic at Emory. So a lot of mostly vaccine counseling and administration before international travel.
Right, yeah. So when people go on travel, preventing that they get sick with those tropical diseases and diseases that we may not necessarily have here. Now, I believe a lot of your research focuses on mosquito-borne diseases. Is that right?
Yes. And so I've been, ever since my fellowship, which I started around 2015, I became interested in viruses that are transmitted by Aedes mosquitoes, which dengue being the most kind of prevalent worldwide and biggest health problem. Also, 2016 was an important year because of the Zika virus outbreak, which did kind of make local news, even in the US, where a lot of these viruses don't naturally get transmitted.
Right. So you mentioned Aedes mosquitoes. Are these the really aggressive kind of striped mosquitoes that we find in our backyards here in Atlanta?
Yeah, we do definitely have them in my backyard. I know for sure.
I have some too.
Yeah, they have this characteristic white stripes on their legs. They're quite beautiful if you zoom in on them, but they're very good virus transmitters. We have mostly one species called Albopictus, is much more prevalent around here.
Yeah.
And a cousin of Albopictus, Aedes aegypti, is the one that's really aggressive, very good at living near people in cities and can really propagate these epidemics of, you hear about, for example, yellow fever, urban cycle transmission. That's mostly Aedes aegypti that's responsible.
So talking a little bit about dengue, can you talk about the research you're doing right now and then thinking about dengue? And in this podcast, we talk about crossing scales and infectious disease. So how does that pertain to your research on dengue?
Yes, so it is a virus, and it's classified as a flavivirus. Flavy being yellow, and yellow fever is the kind of prototypic virus in that group. So named because it gave people liver problems and caused their skin to get yellow, jaundice. Most of the infections don't ever come to clinical attention.
Right. Yeah.
The numbers are about 25% or so, but about a quarter of them do manifest, and they can be what we would call self-limited illness. I think sometimes people that actually have dengue might disagree with the way we nonchalantly talk about it as not a big deal, but they're, they go away on their own. You might get a fever, a headache. It classically causes a headache behind the eyes,
right. Yeah.
A skin rash that looks kind of like a sunburn, and it can cause some other problems as well. Those are the characteristic symptoms, but most people that do get them are better in a week or two.
Okay.
And then yet another rare subset can get severely ill, and then it's one of these classic hemorrhagic fevers that can cause organ dysfunction, bleeding from different sites of the body, and even death.
Yeah.
So it kills about 50,000 people a year, which is
that's sizable.
Yeah. It adds up. There's probably over 4 billion people that live in areas where it's transmitted. Again, it's mostly in the kind of going either direction from the equator in the tropical world. So my research is mostly with the human antibody responses to dengue. So we really focus on the human host immune system and how it responds to infection. And the purpose of that is a few different reasons. One, understanding what factors in an immune response may be protective versus not protective. That would help us understand how to design good vaccines would be a major goal. Also understanding the pattern of responses is diagnostically useful, either to diagnose people who are sick.
So then you're trying to understand how this virus is spread between people, and is that within a city or within a region? And I think you do some work in Brazil.
Yeah, there's currently there's two really interesting clinical trials that are led at Emory, and I'm fortunate to work on both of them. Mm-hmm. So there is a trial in Brazil that's looking at whether release of modified mosquitoes. These are biologically engineered mosquitoes that have Wolbachia bacteria inside of it. So mosquitoes that have that bacteria are less good at transmitting. So the goal is to release that into the environment and then measure an epidemiologic endpoint that we would be involved with is, does that release lead to less transmission? So it's over 3,000 kids in Brazil that are being followed right now.
So that's really interesting. So you're basically saying you have these Wolbachia bacteria, they live inside the mosquitoes, or, as researchers, you can engineer the mosquitoes to get them. And somehow those bacteria within the mosquitoes are good at preventing the spread of this virus that causes dengue. And so you mentioned the mosquitoes, so engineering mosquitoes, stopping them from transmitting is one way. You mentioned antibodies earlier with a view to understand better how to make vaccines and maybe roll those out.
One of the key questions that we're interested in is understanding how changes in the virus genome may affect the way the immune system recognizes the virus. Yeah. And again, this is critical for dengue vaccine development. Because you have to pick a strain to make a vaccine. So the question is always, will that strain induce immunity that applies to all the dengue you could encounter in the world? So we've been fortunate now. We've started to sequence dengue virus genomes from endemic areas. And we've done that from Colombia, from Nicaragua, and starting to do it in Mexico as well, where there's another large intervention trial going on there, and with those sequences we can compare them to reference strains and then engineer any changes in the surface proteins of the virus into a reporter virus, and so this can kind of create an antigenic library of sorts that we can then probe against either monoclonal antibodies or, more importantly, human serum that is immune to dengue from either an infection or a vaccine. So some of the interesting questions we're really able to address now are seeing if dengue vaccines can create immunity that applies to different strains from the same serotype.
Yeah. This has been great. Very interesting to hear about your work, and good luck with your ongoing and future projects. We hope you enjoyed this episode of the Virulent Vortex and look forward to seeing you again. Thanks for watching.